Hello, my name is Dr. Malik King, and today we will be looking at secrets of good erection. Here we'll be looking at the science of good erection, and we will also be looking at the causes of weak erection and some ways we'll be able to take care of weak erection and gain back good erection. But first, we have to understand some basic concepts. Number one, sexual desire is affected by four very important factors. Sexual desire is affected by our hormones, those sex hormones in our body, by our psychological mood, how we're feeling in our emotions, by the quality of the relationship with our sexual partner, and finally by the quality of our past sexual experiences. Number two, before you have a very good erection, there are some external and internal stimulation you need. And this stimulation could come from the five senses: touch, vision, hearing, smell, and taste, or most importantly from the mind, from sexual thoughts or imaginations or fantasies. And it's very important to note that as your age increases, you need more of this stimulation. Also, as the duration of your relationship with your sexual partner increases, you will need more stimulation in order to get that needed arousal for good erection. Because scientifically, you could get adapted or familiar with a stimulus, and therefore it will require more of it to be able to get you aroused and sexually interested. The third point we have to note here is that men also require some very important conditions for them to have a good erection. They require privacy, they require sufficient time and stimulation, and also they want to feel loved, feel needed, feel wanted. So that emotional intimacy is very important, and that is why these three conditions here can affect your erection. If, for example, you have children running around, or the place is not private enough or not secured, or maybe you're just having sex just to have babies and not just for intimate or emotional connection, these things could affect one's erection, and therefore these erotic circumstances have to be present most times for men to have that good erection. The fourth important point to note here is the absence of stress during intercourse. And arousal requires that the man be calm and be able to concentrate his attention and be in the moment. Now, any thought that distracts him will ultimately affect his erection. So if he's afraid or wondering or thinking that will I have an erection? Will I be able to satisfy her? Will I embarrass myself? All these kind of thoughts that distract his attention will ultimately affect his erection and arousal. Number five, there are some anatomical problems that could affect sexual intercourse, affect sexual arousal, affect penetration, and affect erection. Things like phimosis, the curved penis, or Peyronie's disease. These anatomical conditions can affect penetration and invariably lead to poor sexual arousal and poor penile erection. The sixth important point you have to know about having a good erection is the role of hormones. Hormones are those chemicals in the body that help us achieve a good erection. Now, if you have any problem with the amount of testosterone in the testicles, it could lead to poor erection. If there's increase in prolactin hormone, it could affect erection, and anything affecting the thyroid hormones can invariably also affect the erection and sexual arousal. Another important factor are the nerves involved in erection. Erection is controlled largely by the brain centers, and then from the brain to the pelvis and the penis, there are nerves that connect them. So any injury affecting these nerves will invariably lead to poor erection or no erection. And anything affecting stimulus or stimulation at this point too, involving the nerves, can also affect erection. Yet another very important factor are the blood vessels, because we know erection is actually caused by engorgement or filling of the blood vessels of the penis with blood. And so any disease that affects the blood vessels will invariably affect our erection. So hypertension, diabetes, high blood fats, and habits like smoking can cause obstruction into the veins and the arteries and could lead to poor erection. We've already mentioned that blood flow and the blood vessels are very important in achieving and maintaining a good erection, and the heart is responsible for pumping of blood, and so anything that affects the heart will also lead to poor blood flow and poor circulation and could lead to poor erection. Earlier, we mentioned the effect of the mind on sexual performance and penile erection. Depression itself can cause poor penile erection. Also, the drugs used in treating depression can also lead to erectile dysfunction and poor erection. The 11th important point here is that obesity and diabetes, as we earlier mentioned, can cause poor erection. So excessive weight and lack of exercise can predispose you to having erectile dysfunction. And that is why it has been noticed that when people lose weight, they discover there's improvement in their penile erection, because obesity and diabetes can eventually lead to problems with the nerves, problems with the blood vessels, and problems with the hormones like testosterone. 12th point to take note of here is that, as we earlier mentioned, some medical interventions can lead to poor erection. For example, some drugs like drugs used to treat hypertension, depression, or some psychiatric problems, or hard drugs, some addictive substances, or radiation or surgeries involving cancer of the prostate or bladder or colon can affect nerve function, blood flow, and eventually lead to poor erection. So we have come to see that poor erection or erectile dysfunction can have psychogenic, that's from the mind, or physical cause from the body. So it could be injuries or nerve problems or hormonal problems or surgical problems or medications or anything involving the blood flow causing the physical problem, or it could just be from the mind, stress or relationship problems, conflict in a home or in our workplaces causing the erectile dysfunction. So finally, with all this understanding we have gotten, let's see some few tips and secrets that can help you gain good erection. Number one, have sex only when you wish to do so. So you are not forced or coerced, so that you don't have that internal conflict that will lead you to having poor erection and then put you into a vicious cycle. So have sex only when you wish to do so. Number two, create the right conditions for sex. We talked about some conditions that are very important, like privacy, very important for sex, and good arousal and good penile erection. Number three, increase your physical exercise. Very, very important. 30 minutes every day for at least 3 times in a week. Very important. Lose some weight and make sure that you are fit. Number five, healthy eating. Eat a lot of fruits and vegetable. Number six, if you smoke, stop smoking. And also, it will be very important you check with your doctor, you check your blood pressure, you check your blood sugar level, you check your blood fat level, and then they'll assess you for any form of depression or stress, and they'll look at your medications and drugs to be sure none of them is affecting your erection. Also, I did a very comprehensive video giving you 5 simple but powerful ways and tips to overcome weak erection and erectile dysfunction, and I will place the link in the description below or in the YouTube card above. Now, did you learn anything new today? Don't forget to hit the like button and stay subscribed to keep getting awesome and highly educating videos like this. Take charge of your health and happiness.